not age limit. Starting age. Like for me,
Oh.
particularly, like I didn't particularly. I didn't particularly feel that like therapy was important until like I was an adult. And like once I really sat down with my therapist and really started like having those like meaningful conversations, I didn't realize like how I was like, wow, I should have did this like a long time ago.
Mm-hmm.
Yeah, so I guess like what would be like the start age? So you like really to really encourage a young person to say, hey,
Yeah.
you really need to really, let's really start like taking like your overall health like permanently important, like my body, mind, and spirit, like you know.
Yeah, I mean, the earlier the better, right? I mean, you don't want people to kind of become what like OCD or what they call you're like hypochondriacs. But you don't want people to know too much too early because our minds will run with certain things. But I think the earlier the better. Someone should be measuring it, whether it's you or your doctor or whoever. Someone should be measuring your health early and often so that you can know when something's gone wrong. We're all more or less the same on from a medical perspective, but some of our baselines are different. And so if you wait until you're 37 to go and get, your first annual checkup as an adult, and your blood sugar or your blood pressure is above the normal range or below the normal range, you might get put on medication or you might receive certain recommendations, but it could be the case that that's just normal for you, and that's okay.
Right.
You have health in the absence of disease at those numbers, but the only way to know that is if you started earlier. Right? So I say measure early and often, as early as possible.